안녕하세요. Welcome to ISQua's 39th International Conference. I'm Professor Jeffrey Braithwaite, and I am going to be your MC for this session. We are going to explore for the next 3 days technology, culture, and cooperation, looking to the horizon of healthcare. So welcome. 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 You may have noticed I'm not so much a linguist. So welcome to Seoul and ISQua's 39th International Conference. And if I didn't catch you the first time, here is the welcome in your language. So I'm the president of ISQua, which has an onerous responsibility of beginning this fantastic sequence of events that we are going to experience in the next 3 days. We have many people to thank during this introductory session. I'd like to especially thank our Korean organizing committee and the Korean people of Korea who have warmly welcomed us and embraced us in our 39th conference. Thank you. So ISQua is a non-profit organization dedicated to improving healthcare around the world. We've been doing that for almost 4 decades. ISQua is very, very passionate about education, knowledge, sharing knowledge across the world. Our vision is to be the leader of transformation in healthcare worldwide. And in many respects, we fulfill that mission every day through your work. Our mission is to inspire and improve safety and quality, not only amongst the people who come to our conference, but right across low, middle-income and high-income countries. In fact, in all settings where care is delivered. We have 4 values. Our values are of knowledge creation and knowledge sharing. And that's very much at the heart of what you will experience in the next 3 days. Another value is networking. We are very keen on collaborative models of healthcare and collaborative models of sharing together. And that's also what you will experience in the next 3 days. We also want to give voice to everyone. So feel very comfortable if you are not a speaker, if you're not on a panel, to have your voice heard. We are very keen to listen to everyone in our community. We also want to give voice right across health systems, to patients, to patient groups, to leaders in healthcare, to policymakers, to politicians, to clinicians on the front lines. All who come within ISQua's networks to share knowledge have a voice, a place in our large international collaboration. And finally, our value is for action. There is no point in having knowledge and networking and giving voice to everyone if you do not translate that into powerful improvements to healthcare on the front lines of care. So why are we here? Well, I suppose you've already figured out why you're here. You're here at the opening ceremony. But you're here because we have 39 years of experience in delivering the ISQua mission. You're here because there are 1,608 of us here today. Korea, this, I think, is a record for ISQua. There are 290. We kind of lost count, so we put a plus sign after the 290. There's 290 expert speakers and panelists. We represent 77 countries. and there are over 200 presentations and 400 posters. Try your hardest to get maximum value from this, but you will not be able to do everything. It's not feasible to do everything. In fact, we often say about ISQua, you could go back to the start, go again, and you could have a completely different experience. So choose wisely. So thank you to many people. I'd like to thank especially our partners, the Korea Institute for Healthcare Accreditation, HERA, the Health Insurance Review and Assessment Service, and the Korean Society for Health Quality in Healthcare. Thank you. Our sponsors too I'd like to thank: the Seoul Metropolitan Government, the Korea Tourism Organization, and the official carriers Air France and KLM. But don't worry if you didn't travel on those. But thank you. And to our conference sponsors and exhibitors, the Australian Council on Healthcare Standards, the Australian Commission on Safety and Quality in Healthcare, and ACGME Global Services. And a special call to the Commission, who sponsored our wonderful event last night with that spectacular martial arts team. I will not be doing martial arts on the stage for you right now. ISQua couldn't happen without the staff, and Carsten Engel and the staff are fantastic. They're the ones you interface with often. For your services with ISQua, thank you very much, Carsten and staff. To the ISQua board, I'm privileged to lead the ISQua board as president. It's a fine group of people who voluntarily give much to ISQua and much to the world in terms of trying to improve and shape healthcare for the future. Thank you, board. It's a privilege to lead you. The Program Planning Committee is very instrumental. That's the group behind the scenes who made sure that you have a fantastic program to experience in the next 3 days. Special call out to my co-chair, Sang-Il Lee. Professor Lee, thank you very much for co-chairing the Program Planning Committee with me. So we have very many exciting talks to come. This is just a warm-up. So many interesting things to discover together. If you want to connect with us, it's easy to do so. We're about as transparent an organization, a contactable organization as you can get. So you can find us and connect with us through many means. And just finally, I would just like to pay a tribute to Kawaldeep Semi. He left us recently. Our condolences to his family, friends, and the global patient safety community. Let's honor his legacy by promoting patient-centered healthcare worldwide. Thank you, Kawaldeep. So may I welcome to the stage Dr. Lee Wang-jun, the president of ISQua, the Korean Society for Quality, chairman of Myongli Medical Foundation, and a great personal friend. Dr. Lee has a bio that's far too long for me to even start to summarize, but he has done many things for Korea and for worldwide healthcare. Thank you, Dr. Lee.
Thank you. Good morning, everyone. I'm Dr. Lee Wang-jun, the president of ISQua, and it's a real honor to kick off the opening of ISQua's 39th International Conference in front of over 1,600 professionals from 77 countries. First and foremost, I wish to express my profound gratitude to our esteemed assembly of 280 speakers, among them the distinguished former UN Secretary General Ban Ki-moon, who is poised to grace us with the keynote address. I would also like to extend my heartfelt appreciation to ISQua President Jeffrey Braithwaite, the accomplished members of the ISQua Board of Directors, and the dedicated contributors of the Program Committee, whose diligent efforts have culminated in the realization of this conference. Furthermore, it is essential to acknowledge the invaluable support rendered by the HIRA, the Health Insurance Review and Assessment Service, and the KOHIA, the Korean Institute for Healthcare Accreditation, whose partnership has substantially contributed to the resounding success of this event. The 39th conference in Seoul is the largest ISQua has ever had. Do you know why? I think there are three major reasons. First, we've been putting in a lot of effort to get things ready. It's not a joke. Many of ISQua members did their best. And second, K-pop and popular Korean culture like BTS, Squid Game, and Parasite have made Korea super cool. And third, the COVID-19 situation has shown us how important it is to keep patients safe and to manage healthcare well. Our healthcare system is navigating through a complex landscape. We are confronted with soaring healthcare costs, a growing elderly population, an increasing incidence of emerging infectious diseases, climate change shaking things up, and healthcare inequalities across the board. All of these factors pack a punch when it comes to patient safety and the quality of care we deliver. Now is the moment to deeply contemplate how we can harness the potential of new technologies, reshape our healthcare culture, and foster collaborative efforts among healthcare professionals, policymakers, industry stakeholders, and the community at large to address these challenges. In my view, the three pivotal themes of this Congress, technology, culture, and co-production, adeptly encapsulate the current landscape. Along these lines, I'd like to put forth three key points. To begin, the COVID-19 pandemic has disrupted our lives and presented us with a multitude of challenges. However, those of us in the healthcare field has borne a significant brunt, requiring us to play catch-up. In anticipation of future pandemics, which are undoubtedly on the horizon, healthcare institutions and professionals must enhance their crisis management strategies. It is imperative that we take on the responsibility of safeguarding patients' well-being and upholding the standard of care even in the midst of crisis. Next, it's crucial to shift our attention towards fostering collaboration for co-production. Delivering quality care and ensuring patient safety extends beyond the realm of providers. It is essential that patients, as consumers and policymakers, comprehend the paramount significance of this endeavor. Our role is not limited to doing our utmost. It also involves rallying a broader spectrum of individuals around this shared mission. Lastly, we must proactively embrace the adoption of emerging technologies and communication tools, including AI. Despite the transformative impact of the iPhone over the past 15 years, the healthcare sector has lagged behind in embracing change. While prudence remains crucial in healthcare, we must not hesitate to harness novel technologies to revolutionize healthcare systems, enhance hospital safety, and elevate the patient experience. Esteemed experts from around the globe, we are excited to gain valuable insights and profound wisdom from our presentations during the upcoming 4 days. To all my fellow healthcare champions spanning the globe, I'm eagerly anticipating the reminder that our endeavors to enhance healthcare systems hold immense significance and bring forth rewarding outcomes. BTS member J-Hope once said, "When things get tough, look at the people who love you. You will get energy from them." I'd like to rephrase that sentence very slightly and share it with you. When things get tough, look at the people who work with you. You will get energy from them. Wishing you a fantastic time in Seoul. Thank you so much.
Thank you, Dr. Lee. That was a beautiful message for which you have left us. So I would like to next introduce President Jung-Koo Kang. President Jung-Koo Kang is the President of the Health Insurance Review and Assessment Service, HIRA. That's not sufficient, though. He is also the President of the Korean Society for Surgical Oncology, the President of the Korean Society for Coloproctology, the Chairman of the Korean Surgical Infection Society, and President of the Ilsan Cha Medical Center. Sir, you are very busy. It is a privilege to have you with us.
Thank you. Good morning, ladies and gentlemen. I am Jung-Koo Kang, the President of Health Insurance Review and Assessment Service. It is a great honor to attend 39 Conference of International Society of Quality in Healthcare as a co-host. I would like to express my sincere appreciation to President of ISQua Conference for your effort in organizing this conference. My special thanks also go to all speakers and the special guests for gracing us with your presence. Korea takes pride in being globally recognized for providing high advanced quality and safety for healthcare service. I'm especially proud that this conference held in Korea will provide us with an invaluable opportunity to raise global awareness of Korea's healthcare system and share our best practice. We have been committed to advancing regional health security system under strong government leadership since health insurance policy was first introduced in 1977. Established in 2000, HIRA system of Korea have strived for fair health care service across the nation. Our mission is to review, claim, assess the quality of care, and develop their standard. We also play an important role in overcoming COVID-19 pandemic by effecting utilized an integrated management system, especially using drug utilization review system. In this regard, the name of the conference means a lot as we deeply think about shifting toward the sustainable healthcare system and respond quickly to oncoming healthcare crisis. Patient safety is not only top of priority in healthcare sector, but also one of our important goals to be achieved. At the same time, digital technology, including AI, are emerging as an innovative tool in healthcare sector. We must work hard to evolve and take to top of the healthcare service based on our innovative technology and knowledge. To this end, long-lasting efforts to collaboration with healthcare experts in this room are important more than ever for better healthcare service and system. Furthermore, I hope that conference will provide you with a good opportunity to gain brilliant idea into new healthcare trends. Your attendance and active discussion develop this conference. Once again, I would like to extend my sincere gratitude to all of you for glorious moment as a co-host of ISQua 19 International Conference. I wish you have a meaningful and productive time during conference and enjoy Korea tradition and culture during your stay here. Thank you.
Thank you. Thank you very much, Jung Kukang. So I'd next like to introduce Second Minister of Health and Welfare, Min Soo Park, and he is coming to us via video.
Good morning, ladies and gentlemen. I'm Min Soo Park, Vice Minister at the Ministry of Health and Welfare of Korea. I would like to extend my sincere congratulations to the organizers for hosting the 39th ISQua International Conference in Seoul. In particular, thank President Lee Wang-jun of the Korean Society for Quality in Healthcare, President Kang Jung-gu of the Health Insurance Review and Assessment Service, President Lim Young-jin of the Korea Institute for Healthcare Accreditation, and the executives and members of the ISQua for preparing this conference. Since its establishment in 1985, the ISQua has made tireless efforts to improve the quality of healthcare worldwide. I believe that this 39th conference tells us the continuous dedication of ISQua to connect people from all over the world and to work together toward this important goal. More than 1,500 members from 70 countries and 180 invited speakers participate in this conference. This shows that the international community has higher interest in improving the quality of healthcare than ever. Dealing with the COVID-19 pandemic, we recognize the value of medical quality and patient safety. Korea has been striving to improve the quality of healthcare services and to ensure patient safety. Korean government has been operating the accreditation system for medical institutions since 2011. Total 1761 medical institutions have gotten accreditation. We have continued our efforts to create more advanced and safe medical environment for our people through these and other various methods. Here today, you, the experts from all over the world, have gathered to explore and discuss the right path toward the continued and sustainable improvement of the quality of healthcare services. I hope this conference provides the latest findings and insights in improving healthcare quality to the national governments and relevant experts, thereby contributing to improving the overall quality of life for all. Once again, congratulations on this opening. I hope you enjoy our Korean culture and food during your stay and have a memorable time here. I wish you all the best for a successful conference. Thank you.
And in regard to the Korean food, the Korean hosts invited the board of ISQua to a 12-course Korean meal the night before last. Your mission was successful. I am still recovering. I'd also like to pay tribute, along with Min-soo, to, in the audience, Youngjin Lim, President of the Healthcare Accreditation Society of Korea, Dr. Young Koo, President of the Korean Dental Hospital Association, and Jae-shan Song, Vice President of the Korean Hospital Association. Thank you very much for your efforts in Korea and internationally.